Healthcare reform. Today's million-dollar question: is this really the change that America needs? I will be the first of many to say no and continue to disagree. At the point in this time during our nation's economy and the people continuously losing their jobs, with the $940 million price tag that is attached to this plan, I will strongly continue to disagree that this is not the change that America needs. However, with some aspects of this plan, if you have to focus on what is positive about it, there will be 600 million children that initially did not have health care insurance that will now actually be covered. There will also be elderly people that initially did not qualify for Medicaid/Medicare, or even continues to have both, will also be able to be covered. We have their medications covered, as well as their additional health care expenses, being inpatient, outpatient treatment, as well as additional diagnostic testing for preventative maintenance, as they call it, preventative care services. Examples would be diabetes screening, as well as heart testing for additional problems that could prevent stroke and things of those natures. However, when you look at the other side effects of it, that being the downside, is what I'm going to continue to focus on. Again, go back to the price tag and other things that can be actually funded with that $940 million that's going to be used to fund this program over the next 10 years. However, with Congress continuously to focus on the fact that this is actually going to help people in the process, the $940 million can be used in today's use more so to prevent things that people can actually prevent themselves. When you look at people that actually choose to not fund their own health care, not to say that I'm biased against the ones that actually don't have the money to pay for it. When you look at the larger number of people that actually choose to go buy flat screen televisions, very expensive tennis shoes, expensive clothing, these are the same people that actually are the first ones in line to stand up for any free services. However, if you have the money to pay for those said items, material items, why can't you put that same money towards taking care of your health care instead of allowing all the additional working taxpayers to give you these items when you're perfectly capable of spending the money on those same items as well? With me working for a health insurance company, we're going to go back to focus on the fact that there's going to be job loss. The main program here that's funded by working taxpayers is going to be the Healthy Indiana program, which as of with the signing of this health care reform bill, again, it's going to cost taxpayers $940 million. Over the next 10 years, our lovely governor, Mitch Daniels, has already stopped the enrollment process on the Healthy Indiana program, which actually was, I would say, 2 steps above the traditional Medicaid plan. With the Healthy Indiana program, members that were above the traditional poverty line, which is at 240% as of right now, they were able to pay into this program as well as have their children covered and have a private insurance company's name attached to their said insurance plan. Which with this plan, a lot of the services did not require prior authorization, and they also were basically treated as having a traditional Anthem or Aetna or Unicare plan. With the Healthy Indiana plan being pulled, those members that initially were able to apply for the Healthy Indiana plan is now going to increase our state's deficit, which already costs with Medicaid, $10 million a year. The people that are now on HIP are now going to be forced to go on Medicaid, which is going to take away a lot of the additional services that they were able to receive, which through Medicaid, it does not cover preventative health screening, does not cover dental, does not cover vision, does not cover any type of dental or hearing aids, or as they call for women that has to have mastectomies, things of those natures. There's a lot of services that are not covered under either one of those particular plans. One, most importantly, if a woman has to undergo chemotherapy for breast cancer or any said cancer, and the first thing they usually lose is their hair. A hair prosthesis, which is a normal way of saying a wig in today's terms, is not covered. Neither are hearing aids covered under either one of those plans. Now, when you look at the people that actually do have ways to fund their own health care and they choose not to, typically these are the ones that they bypass the county hospital, which in our local area is Wisher. They will bypass Wisher, bypass the other locally considerably poverty-stricken hospitals, just to go to a said private hospital with the hopes of having better services. However, these are the same people that choose to go to these hospitals, bypassing the less fancy-looking ones, and these are the same ones that choose not to pay their bills, to have the doctors have these bills written off, and the same with the hospital, which is also partly the reason why our healthcare costs are continuing to go up. Not only is it just the fault of the insurance companies, you have to look at the people that wait until they either have no insurance, whether it be through job loss or they've just chosen not to pay for it. They're usually the people that have not paid into any portion of paying taxes or anything like that. Maybe the late baby boomers that smoke. They're usually the sickest ones with COPD, emphysema, and all kinds of other pulmonary diseases, which continually to rise our healthcare dollars. When you look at the amount of funding that's actually spent on these particular services, the numbers definitely outweigh what these people have actually put into it. If our system goes back to the way it was, say, 40 to 50 years ago, where the county workers actually came out to inspect the homes and see how these people actually lived, I can guarantee you, by at least by a number of 5 to 10, half of these people don't live in the means of way that they present themselves when they go to ask for county assistance. A lot of these people have their fathers, the kids' fathers living with them. They have more expensive looking type homes on the inside, but yet they're on Section 8. Then you look at the vehicles that they drive and just the way that they carry themselves when they go outside. If they take that same funding that they're using to put in material items and they actually put it towards the health care, we wouldn't have a bill that's indicating that we have to cover our children until they turn 26 years of age if they are non-married. We don't have a bill or the government dictating to you how you're supposed to actually take care of your health, and that should be your own individual choice. In a situation where you have people that actually are indigent and they have absolutely no means to be able to take care of themselves, for example, that senior citizen that's worked 40 to 50 years, or even the wife of that person where they've actually paid into it, I would be all for them having the reduced health care plan or the said health care plan because they've actually paid into it. But I don't feel as though tax dollars should go to pay for someone who feels like it should be handed to them on a silver platter just because the governor or the president decides to say that this is what we need to give them. If they don't care enough about their own health or the health of their children, why should all of our tax dollars be allocated to pay for them when they don't care about their own health? So in closing, I would like to add that maybe if we voted on the president, we voted on these set officials, we should also have a ballot to state whether we want to have our tax dollars contributed to pay for a plan. And I guarantee you won't have as many people turn out to say yes as you have the officials where we're being forced to say this is what we're going to have. Thank you.